So number 2 on the agenda, disregard that, that's a mistake.
Okay.
I wondered, I was like,
Yeah,
election of officers.
I use the same template each time that you change.
I get it.
Can you tell?
I used to do a lot of template writing too, so it's easy to.
All right. I'm calling this meeting to order here at 5:03 p.m. And our first order of business is approval of minutes, so I'll give you a few moments to review that.
I'll make a motion to approve the minutes from the April 6th regular and executive session and the April 13th executive and special session. Second.
Okay, have a second?
Second.
Oh, thank you. All in favor?
I
Opposed? Okay, the minutes will stand as submitted. I also want to take the opportunity to welcome Dr. McAdams to us, our fine group here.
Thank you.
Hopefully, no regrets yet.
Not yet.
Not yet.
Not yet.
Not yet.
All right, awesome. So next on the agenda are division reports. And
well, it looks like the tire amnesty day was a huge success.
It went very well.
4 semi-trailers
Very well,
with
yeah.
dump tires, that's pretty good.
Yeah.
Clean
It
up
was,
there.
it was the same day of Marion's, it was a muddy mess.
Oh,
It was
I
the same
bet.
day as Marion's town cleanup, so they were sending a lot of people out there, but yeah, it was huge success. We're only gonna do it every other year from now on, though.
I do have a question about food trucks. I'm a foodie, I love it. So I see random food trucks and I'm like, ooh, like,
Mhm.
but I always did under the assumption that they should have their license, their permitting license, like in the window, like very obvious.
They're supposed to.
post.
But I have been to several food trucks and I'm like, I don't recall seeing any licenses.
To look, because they're really pretty good about getting a hold of us. They don't,
Well,
the
so
fine
there's
is terrible to getting caught without
there's
them.
one that they're like semi-permanent, I would say. I see them almost always in the same spot in the Spencer and Western. There's a parking lot right there. And they sell really good pork bowls. So I'm still eating from there, even though I have to steal a license. Don't hold it against me. I told you I'm a foodie.
Is it Mom's barbecue?
Don't know, because I've never seen like a name anywhere outside.
What is it, Spencer and where?
Spencer and Western Avenue.
I'm trying to think, because sometimes they come to the hospital.
Mm-hmm.
Well, and that's why I said semi-permanent, because I almost always see it at least sitting there, and it's not always, I think it's usually open on like Thursdays, Fridays, and Saturdays mainly.
So ask them next time.
Yeah.
I mean, if people ask, maybe they'll, or call Dean and ask him.
Well, that was kind of what I wondered, if he had like a list of food trucks that he knows is permitted that.
There is. Lisa
Maybe.
could help you with
Yeah.
that. Just, yeah, so call her. But for you to ask them also shows them that the public cares, and
Yeah.
you probably just need to get it up there where I can see it.
Yeah. And I could be wrong. They could totally be there, and I just missed it because I was more looking at the food menu than anything else. But,
The ones here are really good because they'll tattle on each other.
oh yeah,
So-
oh yeah, they definitely do. It's a dog eat dog world out there.
Yeah.
They,
They're pretty good about getting it because they don't want the penalty for operating without it.
Yeah.
So.
yeah.
Two suicides, April, or March, April. Is that
Mhm.
good for you?
You know, we've had 0 overdose deaths this year, and I hate to curse it, but that is huge. That's huge.
Yeah, because there were a lot.
There were
last year.
47 3 years ago.
Yeah.
So yeah, that's huge. And the suicide numbers are down, comparatively.
Still though.
That's still too many. Mhm. Yeah, that was a disaster.
Yeah. Well, he coaches over there. His team was a little.
So the school got notice on Tuesday that he was deceased, and then that afternoon his family called and said, no, he's not dead. Oh. It was a disaster.
Mm.
I forget that.
Can you give us an update at all on, where we are with the STI and HIV process?
We are moving, Dr. McAdams just got the paperwork this week from, the commissioner's office for the liability insurance.
Okay,
So we have to get that submitted, and they've been to some trainings and now have Wayne County, I think it is, sent them templates for all of the documentation that they'll need. So we're working on transitioning that over to Grant County. So it's just kind of getting a few ducks in a
Okay.
row, but we're close.
making progress.
Yes,
All right.
yes.
Cool, thank you. Thank you.
Have you been getting updates on the new virus from the cruise ship?
Mhm.
Anything that,
So no concern for, I mean,
Is it the hantavirus?
Virus.
So, from everything that I ever read, studied, even when I worked at the health department, it's not necessarily a person to person as much as it is coming in contact with the rodent urine and dried feces and breathing that in. So as far as it actually like them coming home and then spreading it to everybody else, it's slim to none.
this strain,
This
this strain
particular
is human.
strain.
Oh, is it?
Yeah,
Okay.
Yeah.
calming down.
No, 'cause I thought the same
Yeah,
thing
'cause
as well.
I hadn't heard
Yeah,
anything about
it's,
it being a human strain.
It is human to human.
Oh, wow.
But at this point, I mean, they're just saying kind of be conscious that it's out there, but that there's just no concern by the CDC at this point.
I think I read an article over the weekend that there was some concern of it may play dormant and be sexually transmitted for some time.
I had not.
So again,
Oh, I read something about it persisting in semen for like 8 months or
Yeah.
something like
so
that.
that's, I mean, I think it's evolving information and again,
Mhm.
not a source of truth that I read. I'll be in full disclosure, so just trying to kind of be aware.
We're getting weekly emails.
I don't
but
even
at
know if
this
it's
point,
Yeah,
we're-
transmissible
guys are
by
being
that route,
updated.
so that may be a totally a moot point, but yeah, so.
You're probably getting this now too.
I don't know if I've gotten much about the hantavirus.
I'll look, and if not, I'll email the guy that emailed me and say, put him on the list.
Are we tracking measles? Yeah.
I mean, yes, always. I don't think it's ever stopped. Would you agree, Sarah?
Like the 0 case status thing, we have Mr.
I'm confident that it's tracked. And you are correct, it's not on.
Well, you haven't had any cases probably, so. Probably wouldn't.
Do we have an idea in Grant County what our percent immunized population is? Maybe better than that 93% threshold? Probably not.
I will email you that information before I leave here today. I can access it from my computer real easy.
Okay. Cool. Alright. Any other questions about the division report? Would you entertain a motion to approve the division report?
So moved.
You're still perusing, so I'll wait a moment. Okay, all in favor of approving the division report?
Aye.
Opposed? Okay, we will approve the division reports as submitted. As it stands right now, we have nothing other than health officer notes, so fire away, Dr. McCann.
I have no specific notes today, other than just thanks for having me here. For those of you who don't know, I've been in Marion for all of my life outside of some training in other states. So happy to be back here and delighted to serve the community a little bit more directly. So we'll see how that goes.
Welcome.
Do you have questions for us?
Not right now. I'm sure they will come.
Okay, still getting your feet wet.
We've been slammed with a lot of paperwork.
I
A lot of
bet.
paperwork.
I'm glad she says it's a lot of paperwork because I'm on the edge of like, is it too much or is this just the stuff?
It's just in the beginning. It gets much better.
Good.
You get that insurance stuff out of the way, and I think you're
Mhm.
golden for a while.
Awesome. So, very good. No new business, so let's move on to the new business, which is our 2027 budget. And I will give the floor to Tara.
This budget is dollar for dollar identical to last year's, to the current budget, with the exception of we were paying for a data plan for some tablets that we no longer need to pay for. So that was $1,000 in contractual services that has been switched to repair and maintenance. That was an area that was maybe a little short. So everything else is the same, no raises, because I think the county's not giving raises this year, so we didn't ask. If they decide to, they do it across the board and we don't have a say about it anyway. So, if they decide to, we'll just have to rework some figures somewhere else. I'm bringing this to you now because I have to have the HFI budget submitted by June 1st. So I can't wait to hear what the county plans to do. I'll happily answer any questions you have about it.
So how many employees do we have on, I think if I'm looking at this correctly here, that are on grants compared to county payroll? And then, what are we gonna do when those grants run out?
Okay, so none of it is grants. The only one that's a grant is Bruce, the preparedness
Okay.
coordinator.
Okay,
The HFI funding from the state, we'll figure that out when the time comes, is my answer to that. I don't know that it's gonna dry up. I don't know that it's gonna go away. We had to forfeit our tobacco funds to receive the HFI money. So bare minimum, we'll somehow be getting that back, because they can't withhold it from the county.
so the
They
the
just-
carryover fund for the local health tobacco trust fund,
That is old
That-
money.
That's, I was gonna say, that's.
yeah, that's the one that we
Yeah.
actually lost when we took the HFI.
Yes.
Okay,
And I'm just trying to keep this money squirreled because I'm still fighting for a new health department where we're all in the same building. And these are funds, if I can help contribute to the county pot. I haven't even talked to you about this. But if I can help contribute to the cost, the county is more likely to help us move into a new building.
From the capital outlay.
Yes. That's from year 2 of the HFI funding. That was the maximum amount I was allowed to squirrel away in capital outlay.
The tobacco trust is also HFI, right? Now.
So you either take the HFI or you got to keep the tobacco funding. So this is old carryover money
Right.
that's just been left sitting. We do draw really good interest off of this carryover pot. They do give us the interest from it, so.
The county gives you
Mhm.
flat.
It's like $6,000 a month interest that we make off of that carryover money, so they've invested it pretty good.
Curiosity, where does that money sit?
In I do, it's in the county's bank account, but that's why we get the interest, because it is like set aside in the county's bank account. This much of it is the health department.
Okay.
So in
Didn't know
yellow,
how
these
that
they're not funded through the HFI grant?
Yellow is, hang on. Yellow is HFI. All the yellow ones are HFI
Right.
funds.
So it's not just preparedness.
No, the HFI is not a grant. They
Oh.
keep saying it is not
Yeah,
a
so
grant.
I do,
It is
I caught
state
that when you said that the
funding.
first time.
And the state just keeps pounding home, it is not a grant. It's state funding, which is apparently very different.
Didn't it decrease though this year? Or-
It did
Yeah.
by $1.1
I was
million.
gonna say, yeah.
Yes, it did. Changed everything. The green is county funded
Right.
positions.
Did you have to eliminate positions going into 27 based upon the decrease in HFI funds, or just our agreements with other organizations for how we were supporting them?
The agreements for others. A lot of money, like the school liaison, a lot of her funding just had to be pulled back that she was able to use to help the schools. But it was mostly the community partnerships. We had two full-time positions that we transitioned back to part-time, and it just worked out perfect. They were both vacant positions at the time. So nobody lost their job or took a pay cut. We were just able to shift them before we replaced anyone.
That HFI funding or funded nursing overtime, $500, that seems really, I'm just assuming they don't get very much overtime.
Correct.
Okay.
We have several part-time nurses but for the after-hours clinics. Whoever has to work after gets overtime for that. And they'll start having those twice a month starting in June until it feels like the demand has fallen off. They aren't going to do Saturday clinics anymore because people just don't show up. I mean, they would take their Saturday to come in, open the clinic. They would do the reminder calls the night before, and people just don't show up. But the evening clinics, people, I mean, they get really good active participation out of those. So we're not doing Saturday anymore, but we're going to do 2 Tuesdays a month.
So this preparedness coordinator,
Mm-hmm.
half-time, is that like part-time?
Yeah.
And that's the pay for that
Mm-hmm.
but I don't see it over here I don't see it in the salary over on this
Well,
line.
because then it would confuse everything.
Okay,
I just kept him over. That is a grant funded position.
Okay, that
It's
is
the
a grant.
preparedness grant.
Okay.
That's the only thing it gets spent for is his salary.
And do you get some of that?
No, but Dean doesn't do preparedness anymore.
Oh, it was in the annual report. Did he just quit?
Well, he probably just didn't take that out of his
Okay.
standard
Template.
annual
Out of the
report. Yes,
template.
yes. He is considered the backup preparedness coordinator, but he doesn't do anything for preparedness now.
so we don't know for sure what the HFI fund is gonna look like.
For 27,
For
we do.
27. Oh,
We
you
do.
do.
We
Okay.
absolutely do.
It's 1.1
It's-
less than this year.
No,
Okay.
it's the same.
Oh, okay,
It's a 2-year, so it's every time the state redoes their budget, which is every 2 years apparently.
okay,
Yeah.
So when we get an amount, we are locked in for 2 years.
okay.
So 2027 dollar amounts, and the county could cut what they give us, but the state will not. That amount, I already have it in writing, is locked in at that amount. I don't see the county cutting it, but.
Well, I know they're losing a lot of funds too,
Mhm.
so I'm sure they're gonna have to do. I mean, they have, like you said, invested very well, and they are getting interest and getting monies that have never been gotten before, but we're also losing quite a chunk, so.
I thought about that today at the meeting, because now all 100% disabled veterans will have to pay property tax. That's gonna be a hit.
yeah.
I mean, it just
Yeah.
is.
Yeah, and I know the city's losing big money too.
Mhm.
I mean,
And the schools.
mhm. Thanks, Governor Braun.
So does this prevention of disease $20,000, does that cover all of your vaccinations for the year?
No, it covers our Tubersol. We don't pay for our vaccine. We have a
Okay.
contract with VaxCare.
Okay.
That's why it has to be by appointment only now. We schedule the appointment, they send the vaccine we need for that appointment.
Okay.
So it's either state funded, yeah, the free for uninsured, or it's Fax Care.
Okay.
But Tubersol, we've spent 5 times on Tubersol already this year that we did last year. I think it's through the ceiling.
I wonder, because I thought $20,000 isn't.
It's
much.
kind of a catch-all account. No, it's if I need, like, vector control is depleted now. So if we need
Okay.
something for mosquito control, I can take it out of prevention of disease because it falls under prevention of disease. So it's a good slush fund account.
Okay.
I was gonna say, so anytime that if you've got an account and somehow you, like the vector, you end up depleting it and you can actually sometimes pull it from other places depending on,
If it fits under prevention of disease, then
Yeah.
yes, like dye. If I have to buy
Yeah.
more dye this year, I can
because you're looking
you're
for
preventing
sewer.
disease.
Yeah,
Yes.
gotcha.
Yeah.
Yeah, because I was looking at like office supplies and I'm like, I know how much I spend on office supplies and I'm just one
It's been
person.
that amount forever.
Yeah.
Like repairs and maintenance, 2000.
Yeah.
Yes.
It has not increased for
Well, and now,
years.
yes, the vehicles, technically, the county is supposed to cover the repair and maintenance, but because they made them be titled to them. So, okay, then you're gonna do
Is there two?
vehicles?
Yeah.
We have 5 or
Oh, wow.
Yeah,
1, 2, 3, 4, 5, 6.
you have a
Wait,
food, you have
seven.
an environmental.
We have 2 foods, 2 environmental, a nursing, and then it's administrative, but overall, we have 6 vehicles now.
How many nurses do we have altogether?
Full-time or part-time?
Both.
3 full-time nurses, 1 full-time physician's assistant, maybe is her title. And then multiple part-time, like we have Jane, who, right now, Jane, because of her personal life, is only doing our lead risk assessments. And then we have 2 nurses who go out and do all of our vaccines out in the county. And when we have like flu clinics, they come in and work those. So,
Back to the gasoline and auto thing, you said that the county, they owns our, vehicles.
Mhm.
Does that also include fuel? I mean, do they provide fuel for
no.
them as well?
we can
So
get it
it's-
at the county gas pump, which is a huge discount,
Yeah,
but we still get billed for every gallon we use.
okay.
But they are required to cover the insurance on the vehicles, and here again, because they're titled to them now, they cover that cost, and then the repair is on them.
Okay,
So
cool. I just
And they
wondered.
probably have to do that because of the insurance. I
I'm
would
sure,
assume.
probably,
Yeah.
well,
Yeah. Uh,
They probably get a
personal opinion.
they probably get a better rate having like all of the vehicles.
I'm just shocked you have 5 vehicles.
I know, well, it would,
I know.
we never had
It
any.
was 5 vehicles in the time.
It would take to find money, and
Right.
Kevin worked with me really good, as a dealership, a local dealership, worked with me really good on the cost, so,
Right.
yeah.
But you're not concerned with the increase in fuel prices that this budget is?
I-
Who knows?
I mean, if we have to go adjust, then we do,
Okay,
basically, but we do get it half the price that it would cost you at the gas station through the sheriff's department, so.
nice. Okay, cool.
It's probably still cheaper than paying everybody mileage and all that good
Huge
stuff.
cheaper, yeah, because the mileage rate is like 70 cents a mile now.
Yeah, it used to be like 56 or something.
It's crazy. Yeah, it's made a tremendous difference in that respect.
Thank you, Tara, for preparing this and explaining it, and it's a huge amount of work, having done budgets before. You
Not fun.
do an amazing job. No, it
Oh,
is
thank you.
not fun at all. Okay,
Well, I'm
any,
trying to keep everything straight. The HFI funding, the county funding, and then you do have grant, some grants, and it's
Mhm.
like,
yeah,
Well, and the county calls some line items different names than the state calls them. Yeah, it gets confusing.
nobody's ever on the same page.
Hence the spreadsheets, because they really do help me a lot.
excellent. All right. Any other questions about the budget? I would entertain a motion to approve the budget and submit it to the commissioners. Are you so moving?
I am so.
You are so moving. Someone's so second.
I'll second.
All in favor?
Aye.
Opposed? Okay, you approve this budget as submitted, and again, thank you, Tara, for all your hard work. Public comment?
The public said they was not coming to the basement. They don't realize how nice it is down here though, because
It's like
I'm telling you,
surprisingly bright.
like Kathy said, the last time her and I were down here together, there was like things like few and mold spores breeding.
It was
Crazy, like you could see that it was like, oh,
Yeah.
that's bad stuff.
That's nasty. So can someone explain to me the significance of all they all have, oh, never mind, they all have plaques on them, so those would have been the groundbreaking shovels for
Must
various.
have been, 'cause it looks like that one was Ivy Tech. I
Yeah.
can't see.
I didn't initially see the plaques.
I just thought maybe Mike was trying to make sure nobody stole his shovels.
Yeah. It seems like the buckets would be better down here, but. Oh, well, I think we're gonna dig ourselves
I think
out
the
of
maintenance
trouble.
guys use that area for like a break room.
They do-
Oh.
Well, it is, if you look, it is the county break room now
Yeah.
for anybody that wants to come down and use it.
Amy, let me make sure I did it correct. Okay. If I put it in wrong, I might.
Is that
So I can.
Or July 27th, that is correct. I will not be here for the July 27th meeting, so